CHE is actually CHE, an acronym for Community Health Evangelism. In some cases, we say Community Health Education. And this is a strategy for community development, and especially Christian community development. It is an approach that can be used for community development as well as church planting and many other aspects of community development. And how it works is that a training team, what we call a training team, goes into a community and identifies people we call community opinion leaders or champions in a community, because each community will always have champions, people who are opinion leaders, are the gatekeepers in that community. So the training team goes into that community and talks to that leadership or opinion leaders about how good CHE is for community development. And the goodness of CHE is in 3 spheres. It is a strategy that is meant or can be used for improving the health of the community, for promotion of good health, but more importantly, to help people live abundant lives in Jesus Christ. So the general objectives of CHE are usually threefold, as I have said. Talking about good health, promoting good health, prevention of disease, and promotion of abundant lives in Jesus Christ. And so when the training team goes into the community, what the training team would do is to talk to the opinion leaders about the benefit of CHE. We call that a vision seminar. And in practice, what would happen is many of the opinion leaders would buy into that and say, okay, if this CHE is that good, then let's use it. We really want our community to improve. And in practice, we've been seeing, once the vision seminar is done, a number of people will say, we want to be trained on CHE. And we organize to train the community opinion leaders on the CHE strategy. And usually it depends on how the community is organized. There are those that you can gather and train in 1 week seminar, but there are those who want to go to work, and so you organize, they probably give 2 hours in a week. So the training would go over maybe a number of months. And this group that is trained, the opinion leaders, would graduate, and we call them the CHE committee in that community. And it is the CHE committee that is meant to oversee the community development aspects of that community. One of the lessons we take the committee through is needs identification. The committee scans their community and they identify some of the problems and the needs in that community. And they prioritize and say which is the most pressing need. And they go ahead and diagnose and say which are the resources in our community that we can use to meet these needs. So if, for example, the need is sanitation, they would go ahead and say, yes, we think we can build a toilet block to take care of this need. And how do we get money? Oh, maybe we can get from the government, or we can raise money from community members. So they come up with strategies. And once they do that, the committee graduates having identified the needs of the community. Then the next level is the committee will identify people whom we call community health evangelists. And what the community health evangelists do is, after going through training on basic lessons, they visit the homes in their neighborhood, about 10 to 15 homes in their neighborhoods, and they present basic health lessons, like on diarrhea, on worms, on malaria, on breastfeeding, HIV and AIDS, very basic lessons which are presented in a very easy way that every community member can understand without necessarily going into a biology class. And so they visit those homes and just present some of those truths. We call them transferable truths to the community members. Like if I am a CHE, a community health evangelist, I go into a home and I ask, oh, how are you today? Oh, we're fine, except that one of my children is sick. And then the community health evangelist would ask, what is the problem? Then probably the parent says diarrhea, and then they get an entry point to talk about diarrhea and teach the family about diarrhea, oral rehydration salts, and all that. So by the end of that particular visit, the community member has learned about how to prevent diarrhea. And if they implement that, then that family is likely to stay healthy. As they continue with that relationship, keeping visiting and talking about health, they start talking about Jesus. They present the gospel, a transferable truth. And in practice, what we've seen is community members would start to get interested that, oh, this person is interested in my health and is also telling me about Christ. Probably we can be friends. And then they start inviting neighbors. In the process, some people get to accept Christ when they are told about Christ. And then the group continues growing, and we call it a growth group. Meanwhile, these chairs, the community health evangelists, they report their progress to the chair committee. And then the chair committee works together with the training team to implement the projects to turn around the community. In the end analysis, you'd find that people are changing at an individual level as the visits go on. They start forming growth groups where they discuss health issues and they discuss Jesus Christ and they do Bible studies. And it is these growth groups that are introduced to church pastors to start doing follow-up and discipleship and nurturing them and inviting them into a church. Sometimes a church could be born out of the growth group, like a growth group in this community, this area of the community, and another area of the community, and another area. Those growth groups could eventually form a church or a fellowship, and a pastor is asked to lead that fellowship. And in practice, that grows into a church. And the chair committee continues running a project to meet the needs of the community. And as that goes on, we as Missions of Hope would come alongside that chair committee and say, okay, we've seen this is what you are doing. We probably are able to help. And what we usually do is we talk to our partners, like Rocky Mountain Christian Church, for example, and we tell them, in this community that you are adopting, we have this chair committee that is doing this project for the benefit of the community and for furthering the gospel. And this is what they are doing. And if you are able to come alongside them, that's fine. But at least the community has already taken initiative. So it is not like a project from outside there. It's a project owned by the community members, but the partners come alongside the community. At the end of the day, we'd find there is individual change at the family level, but there is also change in the community. One thing I would like to say is, when I narrate chair like that, it looks like it's something that would take 2 weeks and you have a totally changed community. In practice, it can take long. So it needs a lot of patience. It needs dependence on God, because God is the one who causes transformation. If we are talking about people being transformed, turned around, and it can only be by the power of God. So that's basically the whole idea of change.